Okay, so neonatal CPR. We're not talking about infants, we're talking about a neonate, which is another word for a newborn. They were just born. So this is immediately after birth. Typically, once the baby comes out of the birth canal, we're going to wipe them off and get all that off of them so that they're the vernix caseosa off of them so they're not wet. And then we're going to bundle them up to keep them warm. Now, if the baby's doing really well, we might put them on the mother's chest for skin to skin contact, but we're going to talk about how to figure out if they are doing well and what the different steps are. But basically, we're going to dry them off, try to get them warm, and then we're going to assess them to see what's their respiratory rate and what's their pulse. Now, we've been talking about checking pulses in different places. For an adult and a child, we check the carotid pulse. For an infant, we check the brachial pulse. Newborns have something that none of the rest of us have, and that is an umbilical cord. So the easiest place to check the pulse for a neonate is right at the base of the umbilical cord, where the umbilical cord comes out of the belly button. If you don't want to check it there or can't for whatever reason, you could also use a stethoscope and just listen to their chest. They're going to have very thin chest walls and you'll be able to hear their heartbeat very easily. Now, depending on what their pulse is and what their respiratory rate is will depend on what we do. If their pulse is greater than 100, that's awesome. A newborn should have a pulse of about 120. Anything up to 160 is great. So if it's over 100, awesome. Keep the newborn warm, monitor them continuously, make sure they keep that pulse, make sure they keep breathing, make sure you don't see any cyanosis or anything like that. Just keep an eye on them. This is a good time to let them have that skin to skin contact with the mother because they're doing well. Now, one tip I got from a nurse, if you're trying to check the pulse and it's over 100, it's really, really fast and it's actually hard to count. So she suggested that when she counts the pulse of an infant, she basically does her finger like this with each pulse. So she has her one hand feeling the pulse and the other hand going as like a ticker. So you can count 1, 2, 3, 4, 5. Watching your own finger tick, she said, helped her count the pulse. I'll be honest with you, I've never checked the pulse of a neonate. So I'm going to take her word for it that that helps. And then you can also, you're 1, 2, 3, 4. You lose track when you get to 10. I would just keep track. Okay, that's 10. So, remember, keep a 1 on your other finger. When you get to 10 again, keep a 2. When you get to 10 again, keep a 3. And that'll help you keep track of that pulse that's going to be so fast. That'll help you count it. Now, if the pulse is slower, if it's between 60 and 100, this is kind of a gray area. It's not great, but it's not terrible. But we need to get that baby's heart beating faster. So just like with infants and children, the most common cause of a problem with the heart actually comes from that respiratory cause. So for about 90 seconds, we're going to use the BVM and ventilate them just on room air, not even attached to oxygen, just the BVM. Now we're giving a breath every 2 to 3 seconds. So give them about 30 breaths and then recheck their pulse, recheck their breathing. If they're breathing on their own and that pulse is up over 100 now, awesome. Keep them warm, give them to mom for skin to skin contact, and continue that assessment continuously. You're constantly checking that pulse, making sure it's staying fast, making sure they're breathing on their own. Now, if you use that BVM on them for 90 seconds and their pulse still stayed on that 60 to 100 range, we're actually going to attach that BVM to oxygen. Maybe they need a little bit more oxygen going, and we'll continue to ventilate every 2 to 3 seconds. And I can't imagine a scenario in which you deliver a newborn in the field and you don't already have ALS on the way. But if you don't have ALS on the way, you definitely want to get ALS heading your way at this point. If that baby's pulse is still between 60 and 100 after 90 seconds of ventilations with the BVM. Now, if the pulse is less than 60, just like for a child or an infant, we're actually going to start CPR. So it's that same number. That'll make it easier to remember. Just like an infant, if their pulse drops below 60, we're going to start CPR right away. Now, CPR is very different here. This is not a typo. The compressions to breaths ratio is 3 to 1. You 100% have to have 2 rescuers who have practiced this and who know what they're doing. Because it's bum, 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 breath, bum, 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 breath, bum, 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 breath. So the one rescuer is going to be at the feet using the 2 thumbs, right? Still at the same beat. I, breath. I, breath. You're just doing 3 compressions, 1 breath. They need oxygen. They need a lot of breaths. You can't do this by yourself. You have to have another rescuer to help you. You're going to have your BVM attached to oxygen for this. You're going to reassess every 90 seconds. So after about a minute and a half of this, you're going to stop, check the pulse, see if it's up over 60. In normal CPR, we usually don't stop to recheck a pulse because it's very unlikely that you'll get a pulse back. In a newborn, sometimes they just need a little bit of help getting started. So it is likely that you do your 90 seconds and that pulse does come up. Maybe it's between 60 and 100 and we don't need to do CPR. We just need to keep ventilating with the BVM, or maybe it's over 100 and they're doing fine. So every 90 seconds, we'll just keep rechecking. We'll stop CPR, check that pulse, see if they're breathing on their own. And again, I can't imagine ALS is not already there at this point, but for some reason, you didn't call for ALS for the delivery, you definitely want to get them headed your way at this point. Okay, so neonate CPR, quite a bit different for a newborn, but that 3 to 1 is a really big thing. And again, this is something you really want to practice with somebody else so you can get this down. So when it's time to do it, you're not learning it on the spot. So thank you.